So, welcome to our session about digital health and patient empowerment, which will start now with looking at how digital health and digital technology is changing power dynamics between doctors and patients. I think this is a critical subject, so I'm happy that we can have this session with some people here with me that I will introduce to you after introducing into the subject, which I will start now. Okay. So just for an introduction, I would like to show the two perspectives of X-Health or digitalization in healthcare, show you the perspective of the patient, and then show you the perspective of the doctor. And then we will find some questions out of that we want to discuss here together. So from the patient perspective, what does X-Health or digital healthcare mean? First of all, it means that medical knowledge is available for the patient. It's available online in a lot of places, on a lot of sites, in a lot of media. So medical knowledge is not anymore only available by going to a doctor. It's available on the internet, and whatever kind of problems I have, I can Google and I can find something about my symptoms, my diagnosis maybe, etc. Secondly, medicine is coming to patient homes and smartphones more and more. So even therapy and diagnostics is not only available at the doctor's site, but if I have a diabetes, for instance, I can use a diabetes app, I can measure my blood sugar myself, and I can manage my disease with sort of helpers. And we start with online video conference with doctors. And in Switzerland, for instance, we have with Medgate a big telemedicine center where patients can send symptoms and problems via email and get answer and maybe even get a recipe if it's clear what they have. So medicine, therapy, diagnostic becomes available where I am. It becomes as mobile as I am as a patient. Then, using these technologies, of course, I start to gather data. Data on my smartphone. I start to gather data maybe just by taking pictures of discharge letters or results that I get on paper. So I start gathering data. And so I sort of start to build up a personal health record myself. So the question is what to do with this data and how to share it maybe with a doctor. And we can use apps with artificial intelligence to manage our health and to manage our diseases. There are already apps today that give alarms, for instance, if my heartbeat is not as it should be and stuff like that. So we will go on using that. So what does it mean? To summarize, it means I have, as a patient, I have more knowledge, I have more power, I have more engagement, I'm supported to engage myself into my health. But, and this is a big but, all this is true only if my e-health literacy is good enough. If I know where I can find such apps, if I understand the information that's given to me in the internet. And so if my e-health literacy is good, I have a lot of new stuff I can use, and I have a lot of advantages of this digitalization. So now let's look at the doctor's perspective. Patients, that's very clear, patients want to be empowered. This is a study that was done in oncology in a supportive cancer care center. And when you look at the colors, the one with 1% means I prefer to leave all decisions regarding treatment to my doctor. This is only 1% of the patients saying that. Yeah? Most of the patients, that's the green part and that's also the orange part, say, I prefer to share decision-making with my doctor. I want to be informed, I want to know myself, what's going on, and then I want to share the decision-making with my doctor. And that means, of course, a completely new perspective for doctors, to have such informed patients that have maybe other information than the doctor gives to them. So from doctor's perspective, it will often and more often happen that patients come with information they found somewhere in the internet, maybe on reliable sites, maybe not. They come with more questions. They come maybe even with an app that they are using and with data that the doctor should look at. And they want to share that information. And we all know that doctors don't have much time. And the most critical issue at a doctor's office is, how can I be very quick with my patients? Because I have to see a lot of patients during a day. So all of this new information the patient comes with, first of all, is time-consuming for the doctor. Yeah? And it's even time-consuming, not only the information the patient comes with, but also the information that I have additionally as a doctor. I can use knowledge databases and stuff, but also that is time-consuming in the first step. And maybe the patient comes with information that I don't know. Maybe he found some source on the internet with information that I really don't know. So what to do with that? There are far too many apps and far too much knowledge in the internet to know it all, even about my specialty. And then there is a fear of transparency. If I share the data in the form of a personal health record or electronic health record, it becomes very transparent also to the patient how I am treating the patient and what I am doing, and that causes fear also. And there is a fear of competition, because there will be tasks that might be even done better by a computer in the future. There are first studies showing that. I have an example here with a study from Stanford regarding skin tumor, where an artificial intelligence trained Google computer, trained with 130,000 images, was in the results as good as doctors with 11 years of experience. That makes fear for the doctors seeing that. And of course, there is the other side, that also doctors see the new possibilities in treatment and research. And they want to use the knowledge and they want to use it, digitalization, for a better treatment. But now if we compare that, for patient sides, there are almost only advantages, but on the doctor's side, there are some fears, disadvantages, and problems. So I just put up some questions that we would like to discuss here and now, and I will also later on try to involve you into the discussions. Do patients and doctors really act on eye level? And is that possible at all? What kind of support do we need for doctors and patients to sort of accept those new roles and maybe to be trained in that new roles? And how can user-centered design of applications maybe even help to overcome some barriers between doctors and patients? And I tell you, we have some design specialists here. And how can doctors speed up in the use of digital technologies? Right now, the increase of the use on patient side is a lot faster than on doctor's side. So how can we speed up there? And how can e-health literacy be supported so that not only well-trained and patients have these possibilities? So those are some of the questions that I would like to discuss here in our group. And now I would introduce the others to you. Thank you. So it's very seldom to have 4 women and 1 man here in such roles, and I'm happy that it is so. And so maybe I would give you, as the only man on the podium here, the first chance to introduce you and maybe to answer 1 or 2 questions that I put up. Tobias Gantner, and yeah, please, maybe you introduce yourself.
Sure, thank you very much. Good afternoon to everybody. Really happy to have such a large audience here. My name is Tobias Gantner. I'm a medical doctor by training. I'm a surgeon. I have a degree in health economics and law, worked a couple of years in the industry, and then moved on, having learned that I'm not compatible with corporate life. Founded my own company, which is dealing with innovation in healthcare. So we do kind of funky stuff. We look in 3D printing of pills, which I was speaking about yesterday here. So if you're interested in 3D printing of pills, this is what we do. We do a lot of patient engagement things with hackathons. So we have a lot of hackathons going on, if this is interesting for you. We do acoustic biomarkers and are focused on patient empowerment and patient co-creation, patient participation. To try to approach 1 or 2 questions here. I'd like to put this in a broader context. For me, what we look at is some kind of reformation. So we celebrate 500 years of Reformation. What happened at the old days? Well, Martin Luther translated the Bible into German, and he had a guy called Gutenberg who invented the mobile letter printing. So those 2 technologies, or the technology plus 1 guy dared something, translating a Latin book into the country's language, formed a Reformation. So people took to the book, they read it, and they confronted their priest. Look, where does it say what you just said when you were preaching? We see something like that happen in healthcare too. So people are looking for evidence. They're looking for to understand what actually is causing their health. They're looking for transparency. And transparency is something that's very difficult in healthcare because as doctors, we tend to not be questioned. So you go through medical school for 6 years, you go through residency for 6 years, you pay money in order to go into a private practice. And then, having spent more than 18 years in healthcare education, then somebody comes your way and says, look, I have asked Dr. Google or ADA or Babylon Health, and this is what I think I have, and I just need you to sign a prescription. This is, for doctors, a narcissistic insult. And so while we are moving from doctor-centric healthcare to patient-centric healthcare, technology supports us very much in that. And this all started out with the use of smartphones. So like 10 years ago, you wouldn't believe we didn't have smartphones. So the last 10 years or 9 years, all these things came about. People are carrying sensors around. They are taking their heart rates, they're taking their blood pressures, they know their genomic types and so forth. And they're challenging their doctors. And of course, there are some who are left behind, maybe late adopters, people who are not interested in these kind of things. But more and more people start to question doctors and doctors' behavior and doctors' choices. And this puts them in a hard place. And I guess this is why we are here. And so I think digital literacy is important not only for patients, it's important also for doctors. And they should be training this also at university.
No, that's fine. Never give away your microphone. Thank you. Our next guest here is Julia Hagen from Bitkom. And I know that you have been asking patients and doctors what they think about digitalization. So I'm curious to hear what your perspective is.
I'll happily share some of that insight. So I work for Bitkom, which is Germany's Digital Business Association. And I specifically work on healthcare. And what we regularly do, sort of to try to understand where people, patients, citizens, and doctors on the other side are going, is that we do surveys. And so this year we asked patients on one hand side and doctors on the other hand side pretty similar questions about how they inform themselves on the internet and how doctors are confronted with these questions. So, and what we saw on sort of patient/citizen side was pretty interesting because it's sort of a large spectrum between actually empowered patients who would then say, well, I felt that I was actually on the same level as my doctor, because I had all that information. I was able to look up studies and to read up on things that I wanted to know about my illness and my condition. And that's great. We all love to hear that. On the other hand, we also saw in some of the responses we got some sort of cyberchondria, sort of patients who would be worried about the information they find online and who are not able to actually understand if that's correct information and to put it in the right context. So that's the typical effect of you Googling your symptoms and finding out that you're going to die within the next couple of weeks. And that's interesting when you see this on an abstract level, but we then also asked a very, very specific question, and I wanted to share this one number with you, that is that 1 out of 5 patients who's German patients, a representative sample, who's researching online, 1 out of 5 has already changed his medication just after researching online about it. And that doesn't feel right unless you're a doctor yourself. So, and on the other hand, we see that doctors in general are, as Tobias just said, are sort of critical about it. They don't know how to deal with it. They are overwhelmed by many of the information. But then they also see the chance that they could actually get more information from patients that can be useful for them. And they're not opposed to any of that and even think, well, healthcare apps, even though in many discussions it might seem as if doctors are like, oh, don't come with another app and don't do that. But in general, they're really open, and that's something really positive. So what we see is that we have to find a match between those two and sort of find a middle way between cyberchondria and the really empowered patient and tend towards the empowerment, of course.
Yeah, thank you very much. Our next guest is Ulrike Anders, and I know that you have worked as a user experience designer at Microsoft, and then you sort of switched to healthcare, and you are working with startups right now. So I would be interested, like, what is the difference in healthcare, in really working in healthcare and working with startups, having like solutions for patients and doctors? Is there a difference to other branches?
Yeah, of course it is, because in healthcare the patient or the consumer or the client is mostly further away from the companies than in other industries. So in the consumer industry or in retail or anywhere, the company deals with a customer and they have to react to the market. Especially startups do that a lot. You know, they build a product and ask what the problem of the users and the clients is, and they develop products for that. But in healthcare, until now, it's a really closed industry, so there's not a lot of innovation coming into healthcare, but actually now we see the startups coming bottom up, providing solutions for patients, or also technology coming sideways and disrupting healthcare. And there's a lot of change right now and a lot of opportunity, but I think that technology is a lever for change, but it's not necessarily the goal where we should go in healthcare. And the goal is a more human experience, a more opportunity to connect between people. And here you see lots of great products develop. And when we develop those products, I wish that we really put the patient and the human in the center and look at what they need to create the conditions for human connection between the doctor and the patient.
Yeah, thank you very much. And then we have Katina Sostmann, and she's working a lot on interaction. So, yeah, what is your perspective on our problem, or on the perspective and on dynamics between doctors and patients, and what can we do there?
Yeah, I think we are actually building those tools for these interactions, and I totally agree with Ulrike that we should enhance and actually support by technology a more human interaction, so that maybe like in the educational sector we flip and we give a lot of opportunities and guidance through the jungle of information and translate it into the patient's words, so that, and maybe language as well, so that they actually can understand. and maybe these tools can be the objective to initiate a discussion, because I think I see the future in the doctor and the patient looking onto the results and the data gathered by technology maybe, and gathered by the patient and other diagnostic machines, but and interpreted already maybe by an AI, but then looking together with the doctor to the context of a patient and helping him to find the right solution for him, because I think the doctor has the real relationship to somebody, and also the relationship to all the other doctors, so they can really gather it together and have a interdisciplinary 360-degree view onto the patients and see what would be the right solution and the right treatment for him, and considering also his context and the appliance and all that. Yeah.
I would like to go on there. I think we all agree here that with technology coming into the game, the whole process of the relation between doctors and patients, but also the whole healthcare system is changing regarding the roles. And I have the feeling that what we try so far is sort of to digitalize the traditional way of how we do medicine. So where would be the innovation points on the one hand? I know that there are many interesting projects coming from the other side and really seeing like how can we change the processes and the roles. But how can we make that happen broader in healthcare? What do you think?
Well, I think we probably need some kind of an intermediary here. You got the doctors who are very busy seeing patients, and they have like 5 minutes for every patient. And I have colleagues who actually say, look, it takes me 3 minutes to de-Google patients, so I'm stuck with another 2 minutes to put them back on the righteous path. So unless de-Googling is not a part of reimbursement, they will probably run out of time. Plus, a lot of patients leave the office and haven't really understood what the doctor was talking with them about. So how they should be taking their medicine, what their pre-existing condition actually means. So we have been approached by a number of insurance companies, private and public insurance companies, who dwell on the idea of something we call a medical concierge. So somebody who is in the middle, somebody who is your, in quotation marks, professional friend. So who actually understands your condition and can walk you through what the professional actually said, and who makes sure that you take the right medication at the right point in time, and who also oversees all your gears and gadgetry that you have. So you might have wristbands and apps and wearables and pill dispensing devices and all these kind of things, which doctors probably will not occupy themselves with. But you need obviously or probably some kind of intermediary. How much of this intermediary must actually be a human being, a physical human being, or it could be done through artificial intelligence? That's not sure. That might be a question for the future.
I think I can add a different perspective to that. So something that we see among the startups that are members in our business association is that there are actually many health startups who have doctors on their teams, and they actually want to understand the other side. So the doctors who are probably using their products or their services at some point better and design them in a way that they can actually integrate as good as possible into the process. So there was, for example, one story from a startup who, they ended up actually then as an output generating PDFs again so that they could actually be printed, because it was just the only way that the information that app was gathering on the patient and the way they were monitoring their chronic disease was able to be integrated in the flow of the doctor. So at some point you have to take a step back. That's what we see, and not go all the way through with digitizing, and sometimes accept that there are circumstances that you need to adapt to and try to integrate as good as possible in the reality of doctors.
I think I would add, for really building these tools, you really have to integrate all kind of stakeholders in the process, because I think that is really, really important also for the acceptance, that you're not looking into the patient's point of view, but also into maybe the pharmacist's point of view or the IT specialist point of view. Even if you want to integrate something into the IT or the caretakers or somebody else, you have to actually bring all kind of people to the table to make sure that the process is really used by everyone. Otherwise, you will, you won't be successful in using it, because then you have these gaps, and then it is more work for somebody to transfer information from one to the other point.
So I think we sort of made the point that we have to involve doctors and patients very closely into designing those solutions. I would like to add one point more, which is to make the doctors really use that technology so that they can gain experience with it. There's a story I really like from the hospital in Oldenburg. They had to care for people working on the oil platforms. And so, as you cannot always go to the oil platform, they had to do it with telemedicine. And I was talking to that doctors, because then after using that for a while, they started offering telemedicine in emergency care, and they really became a sort of pilot hospital for these kind of services. And those doctors said, well, we had to trust this telemedicine, because you cannot send a helicopter every time a patient has any systems there on the oil platform. So we had to trust that. And by using it and by gaining that experience, they trusted more and more into the system. And so they found the motivation to then offer it also in other areas. So I think this part of really using it and really gaining experience with technology, you said like e-health literacy for doctors, is really a crucial one. What do you think?
I agree, and I actually think it should start in education at university also. When doctors go to school and study medicine, then they're young and really want to adopt technology. And once they've gone through the whole, in the hospital, through the residency, I think they are so far into the tradition and paradigm of doctors' lives that they're so far away from seeing the patient as an equal and using technology. So starting in education would be good.
And maybe also changing a little bit the mindset that this is not only like guidelines and rules on long studies are changing the process and the point of view, but also maybe like trying out and prototyping within the daily life is also a possibility. So the first hospitals are setting up now innovation hubs to really try out things together with different players, and I think that's a good idea, to really prototype within the daily setup and try things out and what's working, because then the acceptance, you can just look how the patients and the doctors and other the people adapt to those solutions and get real feedback at a time when it's not invested a lot of money in, but you really can pour in problems out of the daily life and solve it where you need it.
I'd like to spice this up a little bit here. We're all so much in tune here. It's so harmonic. I'm the only guy here, so that's I guess my role here. Now let's try to face the facts. At the end of the day, it's all about money. We have Baden-Württemberg, which is a county in Germany, and they got rid of what we call Fernbehandlungsverbot, which is a nice German word. It means it's not allowed to treat a patient the first time without physically seeing the patient. So you have to touch the patient. So they got rid of that. But what they didn't do, they did not change the reimbursement. So it's completely uninteresting to do telemedicine, even if there's no Fernbehandlungsverbot anymore. So they would have had, if they really would have believed in telemedicine, if this wouldn't just be paying lip service, they would have had to change the EBM, what we call in Germany IBM code, which they have not done. So it's a little sticky here, we are doing a couple of projects in rural areas, and we selected rural areas where there's no doctor anymore, because if you have a doctor there and you have telemedicine, then this is competition, and competition is always bad in a market like that. So we took places where there's no doctor, and we tried to install doctorless offices, so where we have all these kind of great technology, you know, electronic stethoscopes and ophthalmology stuff and all these kind of things. And the main problem we ran into were, guess what, taxi drivers. Because we deprived them of their primary source of income, picking up Grandma Miller at their doorstep and driving her to a doctor. So they were really scared about all that, and they really opposed that. So you have to calculate a lot of things, and it's my point, what I tell startups is always follow the money. You know, go out like a sniffing dog and follow the money. And so we've got a lot of telemedicine solutions, and I know a lot of people who have done great stuff, but they get disappointed at the end of the day because they're not being reimbursed, or it takes forever and a day until they get to some point. And I think we should probably also turn into that, because medicine tends to be a very protective market. A very quaint, protective market. So, for instance, let me just tell you one more story. We requested to put a doctor's office in a long-distance train. So if you commute from Hamburg to Munich, you could see a doctor. Why not? You know, you got back pain from working, so you could see a doctor. It doesn't work, because in what we call Musterberufsordnung, which is the regulations for doctors, it says being a doctor doesn't mean you are a traveling profession. This dates back to the Middle Ages, where you had, the guys who were doing these funky things at marketplaces, and they were traveling from place to place, and there were no doctors. So we're still in the Middle Ages, and then we're confronting with digital technology.
I agree completely, but I think the reimbursement and the missing structures for financing e-health is it's not so much the focus that we want to face here. We wanted to face the dynamics between doctors and patients, but still I think it's an important point, the reimbursement, because if we want to change doctors to really deal with the digitalization and invest time, maybe that is something that we have to finance. Maybe that is something we have to pay doctors for. Maybe that is an idea. I would like to skip a little bit into the future. Like, what would a doctor look like that we would need in this digital health care? I mean, when I imagine I'm a patient and I go to a doctor with apps, with whatever, or just with symptoms, and I haven't looked for anything before, then I would imagine that the doctor gives me advice of what kind of technologies could I use that would support the disease I have. So let's say give an app on recipe. No, to make that point. But what do we have to do to bring doctors into that role, and what else is there that they would have to learn to really pick up that role of a sort of coach also in a digital healthcare system?
Well, I think you designed a pretty good picture.
I think it is important to educate doctors also to how to really offer their reports and their results for the patients, because I think that is also a crucial part. If you could look from different perspectives of the same results, so how can you transfer this to the patients? I think that is not really solved yet. So how can we help there? And this is, I think, the basis. And then also how to collaborate with other disciplines. I think this is also to be more open, to be more a team player, and to see yourself into an ecosystem and not that much of an expert of only a certain sector, but more like an ecosystem of helpers and supporters, and for the best treatment. I think this is you really have to a little bit to change the mindset, not to be one specific, to be a specific expert, but also to learn how to collaborate with all the others, because I think that's important for that. that will happen because the patient is gathering all that information already, and so the doctors are confronted with all the results of the others. So maybe that is the good thing of the technology support, that all the other doctors are confronted with giving an opinion on that. But I think we have to support that even more.
Yeah, and building on what Katina said, there are so many specialties, and also the knowledge, the medical knowledge doubles every 73 days by 2020, and the environment is just changing so fast, so the doctor can't just rely on their own, like on what they learned in the 60s. You know, they just have to adapt, and I don't really see any reason why the doctor needs special care on how to adopt technology. It's just like they said an oath that they want to support the patient and treat the patient and heal the patient. So that's just their duty to also look at technology, how they can help. And healthcare is not only happening in the doctor's office, it happens everywhere in daily life. And technology accompanies the patient when they buy groceries, when they take the car or take the bicycle. So it's very important that the doctor sees the whole picture.
Let me be very concrete here. Imagine we have a 50-year-old general practitioner. He is sitting in his office. He has enough patients coming to him. Most of the patients are older, of course. What is his motivation to engage with digitalization? Or how can we make a motivation? How can we, yeah?
I mean, Tobias just mentioned the most straightforward incentive. That's the financial incentive, which we are not giving them right now at all, at least from our perspective. But I think, I mean, it's very sad, but I think there's also a generational gap. What we see in our surveys we did with doctors in this year is that sort of the younger generation is extremely technology friendly and open because they fully integrate technology in their everyday life, and they don't want to leave all that behind once they enter hospital. They want to be able to have information at hand when they need it and not look for a paper record whenever they want to have information on patients. I think the change is going to come. It's just very sad that it might take another generation of doctors.
Do we really want to pay doctors for learning new stuff? I mean, I'm a professor for medical informatics. Nobody pays me for learning new stuff. It's just part of my job description. Isn't that the same with doctors?
No, I don't think they have to learn technology. They should be specialists in their field, and we could support them. And we talk to doctors, and actually their benefit out of the extremely for the specialists would be that they have a better database to look at the patients. Actually, they normally are relied on delayed information from hospital, on delayed information from other specialists, or even relied on the patient to bring the right information to him. And if he could, they would be really, really interested to look into more detailed information, and even maybe information gathered by a lifestyle gadget to find out what's wrong and have a better database. We are responsible to really filter and analyze the data so that it is easy for the doctor to look at and find what he should find out of it. But I think it is really, really a benefit also for the doctors, and they told us.
Thank you. Before you, I just want to check if there are questions or comments from the audience. I would like to integrate you, so I'm coming around with my microphone.
Hello, I have a question for Ms. Sanders. Can you give me examples of a couple of products which are very well designed, used by doctors right now?
Technology used by doctors right now?
Products. Well-designed products
Well-designed
used
products.
by doctors.
Good question. Does anybody know any?
Well, all those famous stories of doctors using WhatsApp when they have to communicate with their backup, because that's the easiest way to actually get a hold of the doctor that is at home while they have to. But maybe you have a good example.
Well, there's a story out there, and I don't know if it's an urban legend, but it's a good story, that there's a guy who had back pain for years, and he underwent surgery, and they changed his mattress and everything. And then he switched to a doctor, and the doctor Googled this kind of thing. He would never admit in the first place he would have Googled it, but he Googled it, and he found out he should cut a tennis ball in half. Okay, just take a simple tennis ball, cut it in half, and have the guy sit on it, which obviously does something to the spine, so he sits upright, and the problem was fixed. So 50 Cent fixed a problem that 2 surgeries and a lot of other things couldn't fix. So this guy now integrated it in his daily practice. So I think this is, let's say, a product derived of digitalization.
Okay, any further questions or comments from the audience?
I have a question. In the reality of Germany, where does the money come from? Why we understand that no patient will pay money. Who pays? Krankenhauspraxis oder Krankenhausversicherung? Also Versicherung.
So who pays for digital tools?
Actually, at the moment, the insurance companies are driving this change because they see also the opportunity of prevention there. Like to involve the patient and enhance the patient is also saving money and also bridging the gaps in the whole treatment. And I think they are the drivers right now. But there are also the startups offering, and also the technology companies like Bosch, for example, so like bringing out additional services around their products.
Maybe to add to that, insurances are very active in financing personal health records and also apps all around, like prevention and stuff like that. If it comes to the hospital, the digital, like telemedicine and so on, then it's paid by the DRG in the hospital. And I think the most difficult part is everything that is not in the hospital and not for the insurance, that is in the like GP area, niedergelassener Bereich. Yeah? So that's the biggest problem we have in financing that.
That's actually a good opportunity to mention the digital health challenge that we started at BARMER, a statutory health insurance in Germany here. We started it today, and it's in prevention. So we are looking for a digital solution in prevention.
Any more questions or comments? Mm-hmm.
Panel mentioned the value of e-health in prevention. What about post-treatment, post-procedure care?
I think that is even easier because then you don't have the legal problem that you have to see them. And I think it is also nice to accompany treatment over the border of a hospital. For example, for rehabilitation, it is a pretty good tool to engage the patient over the final release from the hospital, and also especially for those regions where there is no support at all for the recap of the rehabilitation process. There are some interesting also startup solutions we are already trying to implement and connecting to hospital treatment paths so that they can offer that. And this is actually also a good business model for hospitals, and also widening their range of earning money in the end. Yeah.
Maybe, also to add to that, if you are looking at like video conferencing This is possible now in Germany to do that, but still there, we again have a problem with financing it, because for a video consultation, a GP earns like, I think it's €9 or something for one video consultation with a patient, if the patient hasn't been to his office in the last 3 months. Otherwise, it's €6. And so I think that's not really motivating to do that, of course.
Yeah, but I think there are a lot of good technology solutions which are actually engaging the patient for the psychological rehabilitation, but also for the physical. And so maybe the doctors are turning into like coaching and supervising a lot of patients, so they are only involved if there are some questions coming up, or he just has to monitor it and maybe have like fewer interactions which can be paid then. So this can be really good supported by technology, I think. And that this is already accepted. There are already studies going on there.
Yeah, thank you. I would like to do a sort of close-up with my panel here and give one question to you to answer in the end. If we imagine the future and a changed power dynamics between doctors and patients that are really on eye level, looking at the data together, the doctor as a kind of coach, what are the 2 biggest challenges for the doctors to come there and for the patients to come there? Tobias, you may start.
Okay. So I guess for the doctor, it depends. It depends which age you are. I learned in medical school. A professor said one very wise thing while saying every doctor has the patient he or she deserves. So if you are this 50-year-old guy who has like all these 50-year-old roundabout patients who are not in the digital area, you're probably not going to go into the digital area at any time, because nobody will ask you something through email or these kind of things. If you're younger, you probably request all these things to be happening. So you will not put your smartphone away while you enter a hospital where you work as a resident. So I guess for the healthcare profession, it's to appreciate change. And to not consider change to be something animus, you know, something that is not good. So this is the thing for patients, for doctors. For patients, I think it's still the thing to wisely choose what kind of information do I actually appreciate, what kind of information do I discard. Where do I get my medical information from, and which therapy am I going to follow? Because maybe I consult my doctor, and I consult another doctor, and then I go to Ada, and then I go to Babylon Health, and I'm stuck with 4 or 5 different solutions. Now, where am I going to go? Medical concierge? My grandma? I don't know. So this is probably some kind of challenge for the doctor, for the patient.
Just very briefly, I think for the doctors, assuming they are willing to adopt digital technologies, because, well, that's just going to happen anyway. I think what doctors need is the correct framework of incentives. And I don't mean paying them to adopt technologies, but providing the right incentives, the right reimbursement scheme that actually allows them to use them in an intelligent way and to finance them sufficiently so that they can actually use the technology. So that's on the doctor side. And because I think if these products are well designed and they see the benefit, they will want to use it if they actually get the money to do that. Because if they don't, then it's, again, extra hours for doctors, which is probably going to be difficult for them to accept. If we look at the patients, I think, and that's something you put on the slides from the very beginning, it's the e-health literacy. Because health literacy already is a big challenge, and if we then sort of multiply this with the digital divide, it's getting even more complicated. And there's a strong correlation with sort of social background, income, etc. And I think that's a big issue, especially then sort of having in mind how lower social classes are more likely to be affected by certain chronic diseases, etc. So that's going to be a big challenge on the other hand, on patient side, I think.
Yeah, for the doctor side, I think the challenge is actually having the technology available. That's like the fine line between scale and being specific. So you have, for all patients, you need a solution. Like, it needs to be paid from all insurances. Everybody, like, the technology needs to be available for all patients. On the other hand, there need to be specific solutions for specific patients, for patient groups. So I think we have still a long way to go until we are in the age of scale. Until now, we are experimenting or trying things out, which is totally fine. Because we are starting the journey. And on the patient's side, the challenge, I think especially talking about German population, it's probably really taking responsibility for your own health and not giving it up to the doctor, but owning the decision and taking care.
Actually, I think the new challenges are the old challenges. So behavior change is a big challenge for patients, and patient compliance and treatment success is a big challenge for the doctors, and that will be in the future as well, I think, even with technology support.
Thank you very much for this nice closing. Thank you to the panel for this interesting discussion, and that you stayed with us all the time. Thank you.